Now, a couple of other important points to make about cardiac arrest more generally. It's a massive public health problem. It's actually the leading cause of death in the developed world. Hundreds of thousands of Americans each year suffer a cardiac arrest. The number is not very precisely known, but we estimate at least 300,000 Americans each year suffer cardiac arrest. Most victims of cardiac arrest die before even reaching the hospital. So this is very lethal, and very lethal within minutes of suffering cardiac arrest. Indeed, less than 10% of patients actually leave the hospital alive after a cardiac arrest. Now, this number is changing, and one of the purposes of this lecture series is to share with you some of the exciting things that are changing to improve survival. It's not as lethal as it once was. Nonetheless, most people die who have a cardiac arrest. Another very important concept to get across, especially for the healthcare providers listening to this lecture, is that cardiac arrest commonly strikes people in their 50s and 60s. So this is generally healthy people, and it strikes with few warning signs or symptoms. I think many healthcare providers have a bias. We often think that cardiac arrest victims are elderly, people in their 80s, 90s, or older, people with very advanced disease. In fact, that is not who commonly gets cardiac arrest. And by definition, by the way, cardiac arrest is the sudden and abrupt stoppage of the heart. You could argue that technically we all die of cardiac arrest because by definition the heart stops in death. But what we're talking about here is sudden electrical storm of the heart causing collapse, and it's generally people in good health. And we'll return to this when I give you some important examples of famous and prominent people who have had cardiac arrest that you have heard of. Now, one of the things that should both be worrisome and a note of some optimism is that survival from cardiac arrest very much depends on where you live. There's been a number of studies looking at this, but one of the largest and arguably best studies on this in a population fashion was done in 2008. And what this study did was look at cardiac arrest survival in a number of U.S. cities. And what they found was your chance of leaving the hospital alive completely depended on the city in which you had cardiac arrest. This variability in survival, and you can see just how variable it is across these cities, suggests two things. One, that in many cities cardiac arrest survival is worrisomely low, that there are problems. But two, that if we adopted the approaches of the cities with higher cardiac arrest survival, we could save thousands of lives each year from cardiac arrest. And that is food for thought about how we can improve our care, and much of this lecture series will devote itself to thinking through some of these ways to improve